My name is John Trapp, and I'm a pulmonologist. I currently serve as Chief Medical Officer for Bryan Health. I'm really excited to announce our partnership with multiple entities in this quality metric of controlling blood pressure. This is a system-wide metric that we've selected that we hope to impact as many people within our communities as possible. One of the reasons we chose blood pressure is because it's ubiquitous. At every ambulatory visit, we check your blood pressure, and we think that's really important. For the US population, about a third of the population has hypertension, and about half of those, blood pressure is not well controlled. Over a 5-year period, that may account up to 16 million unexpected deaths because of cardiovascular disease. Because of that, we've looked and partnered with AMA, the American Medical Association, on their MAP program. What the AMA MAP program really means is that we work to measure accurately within each of our ambulatory clinics your blood pressure. And then once we get this blood pressure recording, we act rapidly. What does that mean? That means if your blood pressure is uncontrolled or higher than it should be, we do some type of action that makes sense at the time, which may include increased diet changes or exercise or better adherence to your medication therapy. So using this MAP program, we've developed a project where we're working with each of our ambulatory clinics in all of our entities to really work on improving blood pressure control. And this includes not only Bryan Medical Center, but our Bryan Physician Network, Bryan Heart, Merrick Medical Center, and Crete Area Medical Center. I've asked 4 of my colleagues at these entities to share with you what it means for their entity to work on controlling blood pressure as a system goal.
I think it's just really exciting that everybody is going to get on board with treating something that we know is so prevalent, so common, something that we all are aware of and we learn about very early on in our healthcare careers, taking care of high blood pressure, diagnosing high blood pressure. It's great that we can utilize all of the resources we have as an entire healthcare system at Bryan to bring everybody on board with the same goal in mind. Just like everything that we do in healthcare, this is a team effort. It's great to develop those partnerships and relationships across our different communities and our healthcare system. Everybody lives it day to day. Everybody knows these people. They're our patients. And so I think it's just really exciting to have something that we can all work towards a common goal for, which ultimately helps our patients be healthier and our community be healthier as well.
High blood pressure is the most prevalent modifiable risk factor for cardiovascular disease. It's more prevalent than smoking, diabetes, cholesterol. For every 20 systolic points over 115 and every 10 points over 75, the risk of stroke or heart attack doubles. And so this is a huge thing that we as part of a care team can do to help keep our population healthy. Taking care of high blood pressure is definitely a team sport. Everybody has a role, nursing, MAs, everybody who's in contact with the patient. A huge role is taking blood pressure correctly. For example, when the patient's back is not against a chair, when their feet are hanging free, when their arm is not at heart level, each one of those things can cause a rise of blood pressure by 5 points systolic. And so if we're getting false readings, that definitely modifies high blood pressures.
High blood pressure is extremely important, particularly for us in primary care, because it represents a lot of what we're trying to achieve with primary prevention of cardiac incidents. For Nebraskans, that's extremely important. We have a heavy cardiovascular burden, heart attacks, strokes, things along those lines, and anything we can do to mitigate that is going to have a major positive outcome for our patients. We know that it's not just specifically important to one clinic. This is something that is really important to medicine across the board. Setting those goals in a unified manner and keeping the conversation up in between all of our clinics, in between all of our health systems is extremely important so we can improve our outcomes.
They call high blood pressure the silent killer for a reason. People walk around with high blood pressure all the time. They have no idea they have high blood pressure, or maybe they do and it's not well controlled and they don't feel bad day to day. I really think there's a lot of potential to make some important headway and really bringing it into sharper focus. We know that treating high blood pressure impacts health. We know that high blood pressure is really one of the most important cardiovascular risk factors. In our patient panel, we have 73,803 patients that have hypertension as a diagnosis. And if you apply some data from one of the most important clinical trials on treating high blood pressure, at a minimum, we should be able to save 273 lives a year just by doing a better job treating high blood pressure. By shining a light on it like this throughout the system and bringing attention to it, I think we're just going to elevate it, and I think we can really make a difference, save some lives, and help a lot of people out.